Hey, have you ever woken up and tried to say good morning, only to find out your voice has totally vanished? It's a weird feeling, right? You open your mouth but nothing comes out, or maybe you just get a squeak. Suddenly, you're left mouthing words and hoping someone can read your lips. Yep, it's that scratchy, squeaky, or even silent surprise called laryngitis. It can hit you out of nowhere, making even a whisper feel like a struggle. For some, it's just a mild annoyance, but for others, it can be downright alarming. Today, I'm uncovering why you lost your voice, how it happens, and what you can do about it. Whether you're a singer, a teacher, or just someone who loves to chat, knowing the basics can help you bounce back faster. So, clear your throat. Well, not too hard, because we're diving right in. Let's get to the bottom of this vocal mystery together. First off, what exactly is laryngitis? It's a term you've probably heard, but what's really going on inside your throat? It's when your larynx, aka your voice box, gets inflamed. The larynx is a small but mighty organ that sits right at the top of your windpipe, and it's responsible for producing all the sounds you make. This tiny organ at the top of your windpipe normally lets you belt out your favorite song in the shower. It's what gives your voice its unique sound, whether you're singing, laughing, or just chatting with friends. But if it's irritated, your voice can sound raspy, weak, or just gone. Suddenly, you might find yourself croaking like a frog or barely able to get a word out. Now, what causes this vocal vanishing act? Why does your voice decide to take a sudden vacation? Most often, it's a viral infection, like the common cold or flu. When you catch one of these bugs, your body's immune response can make your larynx swell up. Sometimes, yelling too much at a concert or game can strain your vocal cords. Even a night of karaoke or cheering for your favorite team can leave your voice feeling rough the next day. Even allergies, smoking, or breathing in irritants can trigger laryngitis. Things like dust, pollution, or chemical fumes can all irritate your throat and make your voice disappear. Basically, if your vocal cords get swollen, your voice takes a hit. The swelling makes it hard for your vocal cords to move the way they should, so your voice just doesn't sound right. So, how does it actually happen? What's going on inside your throat when you suddenly can't speak? When germs or irritants hit your larynx, the delicate tissue swells up. This inflammation makes it tough for your vocal cords to vibrate and create sound. Your vocal cords can't vibrate smoothly, so the sound you make gets muffled or disappears. It's like trying to play a guitar with soggy strings. Nothing comes out right. You might also feel a sore throat, have a dry cough, or need to clear your throat a lot. Sometimes, you'll notice your voice gets worse as the day goes on, especially if you keep trying to talk. But don't worry, most cases of laryngitis go away on their own in a week or two. Your body is pretty good at healing itself, especially if you give it a little help. Here's what you can do to help your voice bounce back. Think of it as giving your vocal cords a much-needed break. Rest your voice as much as possible. Think of it like putting your vocal cords on vacation. Try not to talk, and definitely avoid shouting or singing until you're better. Stay hydrated, sip warm liquids, and try using a humidifier to keep the air moist. Warm teas, broths, and even just plain water can soothe your throat and speed up recovery. Avoid spicy foods and alcohol, as they can irritate your throat even more. Stick to gentle, soothing foods and drinks while you recover. Avoid whispering. It actually strains your voice more than regular talking. It might feel like you're giving your voice a break, but whispering can actually make things worse. And skip those throat sprays with numbing agents. They might feel good, but they don't help the healing. In fact, they can mask pain and make you accidentally overuse your voice. Here's a quick myth buster. Antibiotics usually won't help, because most laryngitis is caused by viruses, not bacteria. Save the antibiotics for when your doctor says you really need them. But, if you lose your voice for more than 2 weeks, have severe pain, trouble breathing, or even cough up blood, get checked out by a doctor. These could be signs of something more serious, and it's always better to play it safe. Sometimes more serious conditions can cause similar symptoms, and it's always better to be safe than sorry. Your doctor can help rule out anything that needs special treatment. So, next time you lose your voice, remember, your vocal cords just need a little TLC. Be patient and treat your throat with kindness. Take a break, drink plenty of fluids, and let your body do its thing. Rest is your best friend when it comes to healing laryngitis. You'll be back to singing in the shower or shouting at the game in no time. Your voice will thank you for the care, and you'll be ready to speak up again soon. Thanks for tuning in. If you found this helpful, give it a like and hit subscribe for more quick health explainers. We've got plenty more tips and tricks to keep you feeling your best. Take care of your voice, and I'll see you next time. Remember, your voice is one of a kind, so treat it with care.